Provider relations in healthcare refer to the dynamic interactions and collaborations between healthcare providers and the various entities within the healthcare ecosystem. These entities can include hospitals, clinics, physicians, insurers, and other healthcare organizations. The primary goal of provider relations is to establish and maintain effective communication, cooperation, and coordination among these entities to ensure the delivery of high-quality and efficient healthcare services. One key aspect of provider relations is fostering positive relationships between healthcare providers and insurance companies. This involves negotiating contracts, addressing billing and reimbursement issues, and ensuring that healthcare providers receive fair compensation for their services. Effective provider relations contribute to a smoother claims process and help in avoiding disputes that could impact patient care. Another crucial element of provider relations is collaboration among healthcare professionals within a network or system. This involves creating an environment where physicians, nurses, and other healthcare staff can work seamlessly together, share information, and coordinate patient care. This collaboration is essential for delivering comprehensive and well-coordinated healthcare services, ultimately benefiting patients by improving the overall quality of care. Provider relations also play a vital role in addressing challenges within the healthcare industry, such as regulatory changes, technological advancements, and shifts in payment models. Healthcare providers need to stay informed and adapt to these changes, and effective provider relations facilitate this adaptation by fostering open communication and collaboration. In summary, provider relations in healthcare involve building and maintaining positive connections between healthcare providers, insurers, and other entities to ensure effective collaboration, efficient operations, and high-quality patient care. It is a multifaceted approach that addresses contractual, operational, and strategic aspects of the healthcare landscape, contributing to a more integrated and patient-centric healthcare system.